Hello, I'm Spoon, and in this presentation, I'm going to be talking about a journal article that covers fetal radiation exposure during PET scan and CT imaging. That's a lot I just said, but I'll get into it in a little bit. As a disclaimer, I'm not a medical doctor. I'm not trying to give medical advice. I just want to discuss this journal article that I found, and I thought it was really interesting. Please do not use what I say as medical advice. Seek out a medical professional for said advice. All right, to give a little bit of introduction leading into this article. Hi, I'm Spoon. I studied bioengineering for my bachelor's degree, and in my major, I studied some medical imaging, including X-rays, MRIs, ultrasound, ocular optical coherence tomography, a lot of different imaging modalities. In addition to my studies, I also did research in a laboratory and I was a radiation worker. I feel like I was a radiation worker by technicality. I was using radiation producing equipment to do different experiments. And because of this, I had to have been trained and knowledgeable in different types of radiation and how to not hurt myself or others while using said machines. And finally, I am studying health physics, which is the field of study concerning radiation and radiation protection. Um, and I'm also giving this presentation in addition to all of my background because maybe you'll find this interesting. It's a good practice for me to present. And I hope you find this paper interesting. And don't use this as medical advice, please. All right, so the title of this paper is Estimated Fetal Radiation Dose from 18F FDG PET scan CT during the second and third trimesters of pregnancy. This is an article from 2024. What? 2024. Um, Right away in that title, there's a few acronyms that I will go over just to give a little bit of background information in case you don't know a whole lot about nuclear medicine imaging and radiation dosimetry. All right, let's start with computed tomography, specifically X-ray computed tomography. A typical X-ray will use an X-ray tube, maybe, well, this is what's being depicted right here. An X-ray tube will produce X-rays. The X-rays will pass through you and they will cast a shadow. For computed tomography, many X-ray images are taken from different angles in order to construct a volumetric image. In other words, it produces an X-ray image that you can do a lot more with, and it helps you see the inside anatomy. For an X-ray CT machine, since the X-ray images have to be taken from many different angles, the X-ray tube and the X-ray detector array are rotated around you, the patient, instead of you being spun around at like what, 2 to 5 revolutions per second. That would be a little bit uncomfortable, so everything just spins around you. And over here is an X-ray CT and PET machine. The X-ray CT portion of it spins around inside of here. And, this doesn't really show much. A lot of imaging machines are just these white donuts that patients go inside of. Any case, here's what it would look like. This is an actual X-ray CT and PET scan machine. And here is a sample of an X-ray CT image. This is showing a slice of a patient. So you can see like the vertebral column. I think these are the kidneys, uh, liver, stomach, and so on. I want to emphasize before I go on to the next slide, here is the patient in this schematic. Here's the X-ray tube that is shining X-rays through the patient into the detector ray. And this is showing a lot of anatomy using this imaging modality. What if the X-rays came from inside of you? Um, no, that's not just a crazy thing to try out. It actually has some practical applications. So for PET scans or positron emission tomography, a radioactive drug is injected into the patient, and since it is radioactive, it is going to emit radiation that can be measured. So instead of having an X-ray tube on this donut portion and then the detector ray on the other side, instead of the X-rays, or in this case, gamma rays, are produced inside of you, and then the detectors pick up where the X-rays or gamma rays are coming from. The reason I keep switching between saying X-rays and gamma rays is because they are both ionizing radiation. Gamma rays have more energy than X-rays. But for dosimetry purposes, I can kind of use them interchangeably. Now for PET scans, um, the radiation produced is from positron emission that interacts with an electron to produce two gamma rays of a very specific energy, around 511 kilo electron volts, and they go in opposite directions. Put simply, um, with a detector ring like this, you can figure out where different radioactive decays are happening. Um, and since the radioactive drug is injected, you get to image where blood is appearing. Now, the reason you may want to see where blood is appearing, aside from looking at the cardiovascular system, actually, there is nuclear medicine imaging uh, techniques that are meant to image the heart and how blood flows through it. Um, the other more, I think, more common application is to determine if a lesion is cancerous. Cancer has a very high metabolic rate, which means it's going to have more blood flow. And so if you have your blood now radioactive and you're imaging where radiation is coming through a PET scan, a cancerous lesion is probably going to appear a lot as the radioactive material accumulates there. And I mentioned previously this is both a CT machine and a PET scan machine. The reason this is a two for one is because the CT side of things lets you see the anatomy, and the PET scan side of things lets you see where there may be a lot of metabolic activity or blood flow. This is practical because PET scans kind of produce blobs or blurry images. So the CT side of things helps you see where the anatomy is and locating where the PET scan fits into things, and then the PET scan shows you um, where the radioactive injection is accumulating. All right, so I covered CT and PET scans. Let's look at the radiation side of things rather than just the imaging. So unfortunately, I don't have a lot of images on this slide to go off of. It's just a lot of numbers. So the annual radiation dose to US individuals is 6.2 millisieverts. Um, a sievert is a measurement of radiation that considers the biological impact that it has on humans. To give more context to this number, this is much smaller than 1,000 millisieverts, which is the acute dose amount at which sickness starts to appear. You could argue with that number, but it is around this point, maybe a few thousand or a little less, that with an acute dose, so a short-term large radiation exposure, at that point, that's when you start to maybe have skin rending or nausea or a weakened immune system. Now, millisieverts considers the biological impact of a radiation exposure, but in the study I'm about to present, the units to use are milligray. Milligray considers solely the energy deposited from radiation. That does not consider the biological impact of the radiation. For instance, if you are exposed to 1 milligray of X-rays, that corresponds to about 1 millisievert. But if you're exposed to 1 milligray of fast neutron radiation, that's about 20 millisieverts. So there's an incongruency in that part. But for this presentation, you can consider milligrays and millisieverts interchangeable due to the types of radiation present, which are gamma and X-rays, as well as beta radiation, which is what positron radiation is. Now, getting on to dosimetry as it pertains to this study. Um, in the Code of Federal Regulations, I can't find anything really specific to fetal exposure limits, except that for occupational workers or uh, radiation workers, the limit to occupational exposure for fetuses and embryos is 5 millisieverts over the period of gestation. So for the 9 months that a radiation worker is pregnant, their fetus or embryo is only allowed to be exposed up to 5 millisieverts. All right, I've given a little bit of numbers. It doesn't exactly help completely with understanding the study because I've talked about acute exposure, some of the units, but I haven't talked about um, smaller acute exposures that could lead to longer term effects, such as cancer, genetic deformities, other somatic effects. The amount of radiation needed to cause cancer or a genetic defect, that is a whole other discussion and it has its own complexity, but fortunately, the study I'm about to cover includes a recommended value that should not be exceeded, and it's considered that anything below this threshold should not lead to any deterministic effects. Final part of this introduction. Um, I'm going to invent a unit called rad years. Um, in case you aren't super familiar with these units of radiation like millisieverts or milligray, um, I'm coming up with this unit rad year, which is the expected amount of radiation, average radiation exposure to US individuals. So one rad year is 6.2 millisieverts, which is the average US individual annual dose. And for this study, given the type of radiation, one rad year would be equivalent to about 6.2 milligray. To give an example of this conversion, for occupational workers, non-pregnant workers, the exposure limit annually is 50 millisieverts, which is about 8 rad years. And this is for total effective dose equivalent. I'm not going to mention any rad years conversions on the slides. They will be listed if you want to look at, but I'm just going to be using the units used in the study milligray. All right, let's get on to the article. So, the purpose of this study is to investigate the uh, fetal radiation exposure and dosage for FFDG PET CT. We've covered what a PET scan is and what an X-ray CT is. FFDG is the radioactive drug that is injected for the PET scan. In this case, it includes a radioactive isotope of fluorine. This study mentions that there already is prior research, but there's a hole. Prior studies don't always include the combination of PET scans and CTs when they're done at the same time. It mentions inconsistent methodology. Um, I'm not quite sure what they are referring to. Um, and then it also mentions that simulated results on, results on the simulated exposure of Oh my gosh, I'm sorry. Prior research that does simulated results will use models that are not pregnant. And so this study is going to use anatomical models that include pregnant anatomy to better understand what is the dose to fetuses. So there is some prior research. This is just trying to close some of the gaps in that research. For more background, the International Commission on Radiological Protections says that the threshold uh, radiation dose recommended threshold is 100 milligray to the fetus per scan. And experts go as far as to say it should be less than 50 milligray. And to quote the article directly, deterministic effects of radiation, such as congenital malformation, intellectual disability, and microcephaly, have indeed not been described below this threshold. So overall, the goal is to see um, does this type of imaging modality pose a risk to fetuses, and the threshold that is going to be used as the acceptance criteria is 50 milligray. For this study, 18 patients are recruited who are in their second or third trimester of pregnancy. Most were indicated for PET scan and CT imaging due to cancer. Um, for this study, two approaches are used to determine the radiation dose to fetuses. One approach is to use a non-pregnant anatomy phantom and determine the dose absorbed by the uterus, and then to use a pregnant anatomy phantom to estimate the dose directly to the fetus. Um, I'm not going to get too far into the math behind this, but I do want to highlight some of the complexities associated with measuring radiation dose. For one, internal intake of radiation needs to consider a few different factors. For one, let's say you're injected with the FFDG drug. When it's injected, it's going to be dispersed throughout the bloodstream and it's going to decay, exposing you and the surroundings to radiation. When this drug decays, it means there's going to be less drug over time. So naturally, as a physical property, it's going to disappear. But biology also needs to be considered. Blood is filtered through the kidneys, and then eventually that waste, liquid waste, is removed through urination. So the physical process in which this drug disappears includes its own decay. And the other thing is biology in which it's removed from the body. That determines the exposure time. In addition, depending on the distribution of where the drug is, that determines how much exposure is directed towards the fetus or the uterus, how far away are decay moments happening, how many tissues and what kind of tissues are between. That's where the uh, anatomy phantom comes in for the simulation software. And then also the X-ray CT, that's a form of radiation that is being exposed to the patient and fetus externally. So a lot of physical and mathematical things to consider to determine radiation dose. With regards to the results, the study notes that most of the radioactive drug distribution in the fetus mainly resides within the heart and in the brain and kidneys. I think this makes sense. The heart, compared to other blood vessels, has a lot of space for blood to be in. It's supposed to pump it throughout the body. So I think that makes sense for this drug uh, to accumulate in the heart. In addition, the brain is an organ with a lot of metabolic activity, which means it's going to need more blood. The drug is in the blood. It's going to make the brain glow in a PET scan. And then the kidneys, that's responsible for filtering the blood And so the drug is going to be filtered through the kidneys to be expelled throughout the body. So I think all of this uh, intuitively makes sense. And then for the calculated radiation exposures to the fetuses directly from the injected drug, that is measured to be around zero point 0.9 to 3.4 milligray, and for directly from the X-ray CT, that is measured to be around 3 to 15 milligray. Previously, the threshold was listed to be around 50 milligray, and so the sum of these amounts are much smaller by like an order of magnitude. This is a figure that is provided in the article. This is showing some of the X-ray CT images, and then down here you can see the PET scan images. Um, for this particular patient, the caption mentions that they're indicated for this imaging due to, I believe it was possible breast cancer. And then they mentioned that in figure panel D, there is, where does it say? Axial images B through D showed a hypermetabolic nodular lesion of the right breast associated with hypermetabolic lesions of the right axillary and internal mammary lymph nodes. Maybe I'm not reading this right, but it looks like the left side is more glowing, and which would imply more metabolic activity and possible cancer. I won't dwell on this too long, but yeah, these are some of the images that they did provide. I wish the study provided some images on what the simulation looks like, but maybe there's not a whole lot of graphical interfaces. All right, the discussion. Uh, I like how this study didn't just shoot, I'm getting my engineering mixed up, validation versus verification. They didn't just look at the compare the measured dose to the threshold dose. They also followed up to see how the pregnancy turned out. So there are 18 uh, patients recruited in this study, and they say that for all of the births, they were all healthy without any malformities, with two exceptions. There was a patient who had triplets, and so when they were born, they were premature. So that would be one exception. And then the other was a baby born with meningitis, and not much else was explained for that. All the other cases were described as being healthy. In the discussion section, the article also mentions that radiation exposure due to this kind of imaging can be reduced with diuretics. That means the radioactive drug is just going to be urinated out faster through um, well, medically induced increased urination. In addition, using a PET scan with MRI instead of a PET scan with X-ray CT means that you're not getting radiation exposure due to the CT. And then more sensitive PET scan and CT's technology means less radiation is needed to produce images. Also mentioned consideration of pregnant anatomy suggested to reduce exposure overestimation by 18 to 42%. I believe this means that if you don't consider pregnant anatomy and strictly consider exposure to non-pregnant uterus, that means you're overestimating radiation exposure. So, including pregnant anatomy is more accurate to the situation, but it's interesting the uh, potential error that can be produced when doing otherwise. All right, this bullet point um, I have turned orange because the threshold exposure dose was 50 milligray, and the study confirms that, or the results suggest that the exposure is under that threshold for this type of imaging modality with PET scans and CTs. The results were compared to previous studies, and things were mostly consistent except for one study, which showed that the CT contribution to radiation exposure was much higher than what's shown in this study. For them, it was around 16 to 31 milligray. Definitely much higher than what was found in this study, but below the 50 milligray threshold. And the authors acknowledged some limitations to this sample group. Only 18 patients were included, which is small. Then again, I imagine it's kind of hard to recruit for a study like this. What's the population size of pregnant individuals who are indicated for PET scan and CT imaging? Um, and yes, I've discussed a little bit of the imaging modalities in the study and the radiation exposure. And ultimately, a study like this would be useful for doctors to compare what is the risk versus reward of using imaging modalities like this. I hope you found this presentation interesting and found the article interesting as well. And I hope you have a great day. Thank you. All right, let's see if I can stop recording. All right, there we go.